Thank you. And I want to congratulate the Injured Workers Association for their hard work and dedication to put this together, to be honest with you. As stated, I'm Brian Henderson. I'm the president of the Edmonton and District Labour Council. And I must start by saying that I am no expert when it comes to WCB, but what I can tell you is that it's my experiences that I have had while I was a full-time officer with the Canadian Union of Postal Workers. I can also tell you the problems experienced by workers in our community when WCB doesn't work for them is far-reaching. On many occasions, I would hear WCB denying members' claims based on medical evidence submitted by WCB doctors and paid administrators, even though a member's own physician has conducted the findings through medical examinations that the findings of WCB are not the same as what the person's own physician is. In some cases, we have been supported by a second opinion, and that being examined by a specialist. That is why point 1 on the petition is a critical aspect and would allow for a far and true opinion based on medical evidence. The same can be said for point 2 on the petition when it comes to replacing the medical panel commissioner and medical review panels with truly independent medical examinations who have no stake in the outcome of their decision. It seems that the Workers' Compensation Board only has one thing on their mind, and that is to have injured workers return to work, even though they are not physically capable to do so, have not completed their therapy, or received approval from their physician. And as most employees live from paycheck to paycheck with the threat of losing their income, return to work knowing full well that they are not physically capable of doing so, which point 6 of the petition also addresses. Real problems are created in a community when vulnerable people who may not have completed all of the things required by them, by their caregivers, feel forced to return to work. These problems extend beyond the employer-employee relationship, which is reason enough to examine the system, but also into one's family, one's neighborhood, and one's support network. And guess where the people who need additional supports, be they physical, like transportation to and from work, doctor's appointments, or psychological, they turn to their families and their communities. Charitable organizations are already stretching much needed programming to the limits, and families often don't have the expertise to assist sick or injured loved ones. It is far wiser to provide adequate opportunity for people to return to work when it is safe for them to do so, and with dignity. They focus on this program as they believe keeping costs down for employers is what the stakeholders want to see. The government of Alberta needs to change the WCB Act and implement changes that are fair to all workers and not just reward companies with low rates, especially those who have poor safety records. WCB needs to abolish their incentive program for the caseworkers for what I believe is 2 reasons. 1, paying someone a bonus to meet a quota only entices the caseworker to have someone return to work before they are able and ready to. 2, or the second reason, should the caseworker not meet the quota set by WCB, could lead to unfair discipline being imposed on the employee. I have received calls from both union and non-union members who have been denied their claim for WCB and not being able to find employment due to their restrictions. Stress over worrying where their next meal will come from or how they're going to pay for their rent or their mortgage. Those who are unionized may be lucky enough to be covered by a short-term or a long-term disability plan, but that can only rely, and they can rely on it while waiting for their appeal to be heard. But it's the ones who don't have the coverage is what I want to talk about. As a Labour Council, we experience how many bring stress on an already overused social system. People having to rely on the food bank, for instance, and that is if they are even willing to go there. Or they may have to apply for AISH, once again, if they're willing, feeling they are asking for handouts and believe that this is below their dignity. Eviction, loss of their home, or even homelessness because there are no family supports can also add further stress. All of these factors put strain on their recovery, and I would go as far as to say that their emotional side of what was once a pleasant person now reverts to unpleasant thoughts or actions. We believe that every person has the right to a healthy and safe workplace and a healthy and safe community. And we believe that this health and safety extends to the emotion and physical health of a person on his and her community, family structure, and society as a whole. WCB, forgot a word. WCB is meant to support workers so they can return to work when it is safe for everyone, themselves, their co-workers, their employers, and their communities. Let's get WCB to do what they're supposed to do. And an injury to one is an injury to all. Thanks.